It is so often a time of year when there is so much joy, but there is also so much grief, so much stress, and a heavy mental load for so many people to carry. But there is help out there. So that's what we're going to talk about, especially when it comes to suicide prevention here in today's KSAT Q&A. We are joined now by Kristina Meyer. She is the senior clinical trainer at the Center for Healthcare Services. Kristina, thanks for your time here this evening. We appreciate it. First, I want to talk about what you all see during this time of year. There is a long to-do list for people. There is, a time of family gatherings, but there's also a time where, it's a time when people are reminded that, family may not be in their lives. Grief is something that comes up this time of year as well. So what do you all see in people who may be struggling?
Yeah, definitely. First, I want to say thank you for having me on. I'm happy to be here. Certainly during the holidays, we see a lot of different mental health conditions coming up, or people who already have mental health conditions. They're in a vulnerable spot during the holidays. We see a lot of depression, anxiety, loneliness, grief. There's a lot of stressors that come with the holidays, right? Sometimes you've got a busy schedule. Sometimes it's family dynamics, friend dynamics. And for others, there's loneliness because they don't have family around or they don't have friends to support them. And then, of course, if there's a recent loss, that can certainly play into somebody's challenges during the holidays, especially those first, holidays and anniversaries after somebody has passed away.
How important is intervention, whether it's calling, 988, which is the National Suicide Prevention Hotline? I've got a number here now for the Centers for Healthcare Services 24/7 crisis line. It's 210-223-7233 or chcsbc.org. How important is intervention, or just calling a friend that you think may be lonely?
It's much more important than I think people realize. Just that human connection is so impactful and so powerful. I've had clients tell me that nobody ever asked them truly how they were doing, right? And just that question, not just the, hey, how are you, but how are you truly doing, can make a huge difference. And then as a person supporting somebody with mental health challenges, being armed with the resources, right? So the phone numbers for the national crisis line or the local mental health crisis line, which here in Bexar County is the Center for Healthcare Services. So making sure you have that information, but really honestly being present and truly caring about how somebody's feeling makes the biggest difference.
Could be a lifesaver.
Yes.
If somebody feels like they need help, that can be a scary step to take. So if somebody were to call the Center for Healthcare Services, what sort of help is available through your organization?
Yes, we have all kinds of services in our organization. We have adult behavioral health, in which we provide case management and we provide counseling to people struggling with mental health challenges. We have a children's mental health clinic as well. We have early childhood intervention, substance use, developmental disabilities. So we have a wide range of services, as well as services in the justice program. So if somebody calls CHCS, they'll be connected with the service that fits their needs the best and people who are really well trained in how to handle these challenges.
And if somebody does call, is there any commitment that they are enrolled in some sort of program or that they have to follow through with something? What does one call sign someone up for?
Sure. So every program, I should say almost every program we have is voluntary. We do have some court-ordered programs, but as far as behavioral health, getting a counselor, those kinds of things are voluntary. So if somebody wants to call, even just to ask about services, they're not committed to anything. Even if they go through enrollment, of course, we would like them to stay so we can help them. If the more they participate, the more successful the treatment is, but it's all voluntary for them. So they aren't required to commit to anything.
Talking with Kristina Meyer with the Center for Healthcare Services, senior clinical trainer. We got some statistics that you sent over, and I really appreciate that. This is the demographics at higher risk for suicidal behaviors: working age men, military service members and veterans, American Indians and Alaska Natives, sexual and gender minority populations, older adults, individuals in child welfare and justice settings. Obviously, we're Military City, USA. There are a lot of service members and veterans who call San Antonio and South Texas home. Why are they particularly susceptible, I guess, to suicidal behaviors and thoughts?
Sure. Well, the things that people experience in the military are things that we can't even imagine as civilians, right? They're very traumatic events that they're experiencing, especially those that are out in combat, right? They might be experiencing deaths of their friends, their other service members, or deaths of civilians in the areas that they are serving in. So that puts them at much higher risk for suicidal thoughts or attempting suicide, because it's hard to carry that emotional burden, right? So all of those things that they're experiencing play a huge role in mental health, which I'm happy that the VA is also putting a lot of emphasis on mental health for veterans as well.
Before we let you go, I do want to ask about a financial commitment here, because financial stress is also a big mental health challenge, especially this time of year. So if somebody needs help from the Center for Healthcare Services, what does the payment, the cost look like?
We serve everybody and anybody regardless of their ability to pay. So, of course, there are insurances that cover mental health services, but if somebody is unable to pay or they're uninsured, we're going to serve them regardless of their income, regardless of their financial challenges.
A lot of people think asking for help is a sign of weakness. I think it's just the opposite. It's a sign of strength. And the Center for Healthcare Services in our community to help. Kristina Meyer, always thank you so much for your time.
Thank you so much. I was happy to be here.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.